Welcome everyone. I'm just going to share my screen. This one here, share. To the top. Okay, can everybody see that? I don't know, Christina, can you see it?
I can see it, yes.
Okay, so we're going to get started. This is being recorded and we will be sharing the link with our list so people can review this recording as needed. My name is Laura Anonen. I'm the Community Development Worker at Don Valley Community Legal Services. My colleague Christine is here. Did you want to introduce yourself?
I will well, I can introduce myself. My name
Okay,
is Christine DaCosta Antunes. I am one of the staff lawyers at Don Valley Community Legal Services.
great. Okay, so I'm going to quickly do an overview of what we do and who we are in our services, and then I'm going to pass it to Christine for the legal part of the presentation. So today the topic is completing the ODSP disability determination package for medical professionals. And I'm going to just do a land acknowledgement before we get into it. Although we're meeting virtually, we at Don Valley, we're located on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. We are near the Don River, which flows into Lake Ontario. We are committed to decolonization and reconciliation. We are grateful to have this opportunity to be present, to listen, and to allow each of us to talk about legal issues and how they affect our life and healing. Okay, and just a quick legal disclaimer. The information provided today is for general information purposes only and does not constitute legal or other professional advice or an opinion of any kind. Please contact us or another legal clinic, lawyer, or paralegal to discuss specific legal issues. And just to note, at our clinic, we also have a zero tolerance policy for abusive behavior towards our staff. And quickly, who we are. So we are a community legal clinic. We're funded by Legal Aid Ontario. Our services are completely free. We don't charge anyone. You might remember the two clinics, East Toronto and Flemington. They merged and became Don Valley in 2019. And we have a staff of lawyers, paralegals, law students, admin staff, and myself, community developer, on our team. We also provide public legal education workshops like this one today. We do a lot of outreach in the communities we serve, and we participate in law reform and advocacy. We only handle 4 areas of law at our legal clinic. So we do housing law for tenants only. We do not help landlords. We do employment law. We do immigration law, and we do income supports. And Christine, as she noted, is the head of our income supports team. We don't do these areas of law, but we can provide referrals to people, to clients, if they do need other help. This information is also available on our website if you can't remember all of this right now. And then just our catchment area, there is a legal clinic in every part of the province and in Toronto. Our boundaries are from Lake Ontario on the south up to the 401 in York Mills in the north, and then from Yonge Street and the Don River to Victoria Park Avenue on the east. So if you're on, let's say, the other side of Victoria Park, there's a different legal clinic there, West Scarborough. We have Willowdale north of us. So if a client does come to us that's outside of our catchment, that's okay. We'll refer them to the correct legal clinic. Oh, in our office, we are inside the Thorncliffe Park Community Hub. It's the new hub up here in Thorncliffe inside the East York Town Center, which is the mall at 45 Overley Boulevard. It used to be the COVID vaccine clinic, and now it's this beautiful hub. So we're up there on the second floor. This is how to contact us. So if clients have questions, you can refer them to our intake line, which is extension 1. They have to leave a message. You're not going to get a live person when you call. That's how we work. We get too many calls every day. So they'll leave a message and we'll call back within 3 business days. Our intake line's also open certain hours and it's closed other hours. Check our website. If it changes, we'll post it on the website. And then just to note, we no longer accept walk-ins. We do have what we call in-person intake service appointments on Monday and Tuesdays from 1:30 to 4:30. So clients need to make an appointment though to come to those intake appointments. So the best way for folks to reach us, call us and leave a message on extension 1. And then I'm just going to share, we have a website full of great resources you can share with clients. And we also have a survey. We'll share this again at the end. If you want to scan the QR code, we'd love your feedback, and we'll use it to improve for future workshops. And that's it for the overview. So I'm going to stop sharing quickly and jump to the other slideshow.
Okay, and while Laura's doing that, I will just give a quick background about our income maintenance team. Like she said, that's one of the areas of law we practice at the clinic. It is predominantly focused on ODSP appeals. Um, but we also do other kinds of income maintenance matters. So we do Ontario Works, refusals, terminations, suspensions, ODSP suspensions or terminations. We also do some work around pensions, the public pensions like old age security and CPP, also other branches of CPP like CPP disability. So there's a few areas we cover, but again, predominantly ODSP appeals. I have been at the clinic for a long time, over 30 years. I actually articled there. Um, and I've been doing, income maintenance work for a very, probably close to 20 years. On our team, we have 4 people, 3 lawyers, one of which is in on this webinar, Rana Esmail. And we have a paralegal as well. So I thought maybe if you don't mind, I would just love to hear, take a minute if you don't mind, and like just to find out, where your office is, what kind of doctor you are, and whether you do any kind of ODSP applications. Do you have any experience with it? So I thought maybe Alea, or is it Dr. Dumo, if you don't mind introducing yourself very briefly.
Okay, yeah. So I'm a family doctor based at Midtown, Toronto. I'm a British trained family doctor, so I've come in from the UK. So obviously, learning the ropes, learning the system. So I think obviously this will be quite a good forum for me to learn about these forms because I've had the forms, people come in with the forms and to fill out. So I think that's why I wanted to join in.
Okay, that's great. Thank you. Welcome. And Kamini, I don't know if you can hear us or you can take yourself off mute.
I know they had asked for the
Yeah.
recording, so they might not be
Yeah.
able to unmute at the
Okay.
moment.
Yes. Okay. So,
Okay.
so it looks like Dr. Dumo, we may be just, you may be the only live person on this webinar, which is absolutely fine. Welcome, and we appreciate that you had, wanted to take part in this. We actually sent out invitations to all the doctors in our catchment area, all the family doctors, and as you can see, very few have called in. And we do certainly understand that your practices are very busy and of course aren't only focused on these type of cases, but we really appreciate when people can take the time to learn about this because it does really have a significant effect on our clients when doctors are involved in their cases for various reasons. So again, thank you. So as you may know, ODSP stands for Ontario Disability Support Program benefits, and it is a form of social assistance. So there's basically two main forms of the provincial social assistance, which is ODSP, and then the basic one is Ontario Works, which often it's more informally known as welfare. So it is money that people can get and benefits people can get when they don't have a lot of income. ODSP is like welfare, like Ontario Works, but it is for people who predominantly have been found to be a disabled person. Um, they have to medically qualify with a few exceptions. And the other thing is they have to financially qualify. So again, it's a form of social assistance, so they have to be below a certain level of income. And there's other requirements as well in terms of assets, in terms of immigration status, et cetera, et cetera. So why is ODSP important? Okay, so a lot of people apply for ODSP. And the reason they want ODSP, there's a couple of reasons. So first of all, when you are on Ontario Works, the system is based on people, they're expected to look for work. Okay. And there are exceptions to that, for different reasons, for childcare reasons, for whatever. But the basic premise of the Ontario Work system is you are expected to look for work. Um, but of course, we know there are many people who can't work because of their health conditions. And so they are then allowed to, or sometimes encouraged to apply for ODSP. The good thing about being on ODSP is you are not expected to be looking for work. So that kind of requirement is taken away from those people, which for a lot of people is a huge relief. People are allowed to work while they are on ODSP. Often this is part-time work. Of course, their income, any employment income then is supposed to be deducted from their ODSP. But that's one of the reasons why people want to go on ODSP, so that they are not expected to be looking for work when they really can't work. The other very important reason why people want to be on ODSP is there is more money. So when a person is on welfare or Ontario Works, it's a very small amount of money. Lots of people think that, oh, people are on welfare, they're living high off the hog, but that is not true. And I'm just going to give you some figures just so you can see what I mean. So for a person who is on, a single person who is on Ontario Works or welfare, the maximum amount they can get for what we call basic needs and for shelter, the basic amount is $733 a month. Okay. So clearly, this is not a lot of money. It is extremely hard for people to live on this amount of money. If a person is found eligible for ODSP, it's more money, significantly more money. It's still not rich, but a single person on ODSP uh, can get up to, for basic and for shelter, $1,400, and 1,408 would be the maximum for basic and shelter. Now, there's a couple of other things you can also get, like for special diet needs, for sometimes for medical transportation, but that is, that is the basic needs and shelter amount generally. So as you can see, it's not a lot of money. Even if somebody is on ODSP, they are struggling. So just to give you an example, so the lowest level, I've looked at some stats, the lowest level for so if the poverty line in Ontario, the lowest that I could find is for a single person, 1608 a month. So even if you are on ODSP, you are still approximately $200 under the poverty line. And if you are on Ontario Works, you're nowhere even close to it. You're basically $900 a month below the poverty. That's the minimum poverty line. We all know that apartments are expensive, housing is expensive. So I looked at some stats. One bedroom in Toronto is going on average for $2,100 a month. For a bachelor apartment, we are looking at on average $1,700 a month. That's in Toronto, might be a little less in some other places, but not always. So as you can see, these people are struggling, especially the people who are on welfare. And how are they managing? Well, they're not managing a lot of them. And you can see what's happening. Increased numbers of homelessness, no surprise. um, people living in precarious living situations, shared accommodation with people they don't know, um, you know, uh, people who are overcrowding in their apartments, um, people who are not declaring income. So when you are on social assistance, if you have income from other places, you should be declaring it because it gets then deducted from your social assistance. So in some cases, not always intentional, in some cases, people are intentionally not declaring income or working under the table because that's how they're surviving. The problem with that is if they're discovered, then they could potentially face fraud charges. So these are, this is what's happening. And a main reason is, one of the main reasons is because the amounts are just so low. And for Ontario Works, the amounts haven't changed significantly in many years. So anyways, just to give you a bit of an idea why it's so important and why it is then very important for you, you are a very important part of the application process. And if there's any way you can increase the chances of success for people who you think are disabled, or it really can make a difference. So we're going to go through the slides, explaining a few things and showing how you can, perhaps more accurately or thoroughly complete these forms to increase the chances of your patients being accepted for this. So Laura, can you move to the next slide, please?
Yeah. I also want to note Dr. Cameron is with us as well.
Oh, okay.
We
Hi,
have
Dr. Cameron.
two.
Welcome. Dr.
There.
Cameron, I don't know if you're able to talk. Uh, oh, okay. If
Sorry.
you're able
There we go.
to,
Oh,
if you're able to speak, we did ask Dr. Dumo to introduce himself, and we wonder if you would mind introducing yourself, telling us what kind of uh, doctor you are, and also if you've had some experience with ODSP applications.
Okay, can you hear me?
Yes,
Oh,
absolutely.
excellent. Okay, I'm a family doctor who focuses mainly on doing psychotherapy for mood and anxiety disorders. And I work downtown in Toronto at a clinic with some other psychiatrists. But I'm a family doctor.
Mhm.
And I do fill out the ODSP forms. Um, I've had like 4 or 5 of them in the last couple of years.
Mm. Okay.
So,
Okay, good to know. So again, welcome. Thank you for taking part of this. Like I said before, we know that doctors are very busy, overwhelmed in some cases or lots of cases. So we really appreciate you taking part in this because it really is important for the patients who need it. Um, so, Laura, can we switch to the next slide, please?
yeah. There we go. This one.
The definitions
Oh,
slide. Or
sorry,
or
back.
can I do it? I'm wondering if oh no, I can't do it.
Um, no, because it's my screen that I'm sharing.
Okay. Okay, so to the next slide.
Next one. This one. Disability determination package.
It's the one that says Ontario legal definition because you have the
Oh, the
title
first one. Yeah.
page there. Yeah.
It's up. Yeah.
Okay, maybe I'm just not seeing it.
Oh, the
I
slide I
can't
see.
see it.
Oh,
I can't see it.
you can't. What do you? I
I
have one
see
to write.
the cover page which says completing the ODSP
Oh,
disability
oh.
determination package.
Let's see. I'm gonna try
Okay, there
again.
we are. You got it. You got it.
Um, yeah, but hold on one second. I'm gonna try it.
Gotta love technology.
So sorry. From current slide. If I do that, can you see
Yes.
this?
Yes.
Okay.
Yeah, that's perfect. Okay. So here we're just giving you a summary of what the definition is, like what people have to show in order to be found medically eligible for ODSP. And by the way, I should mention, in case you're interested, there are other ways of being of meeting that kind of medical eligibility part of ODSP. So like I said before, in order to qualify for ODSP, you have to be medically eligible with a few exceptions, and you have to be financially eligible because it's a form of social assistance. So for the medical eligibility part, there are some exceptions where people don't have to meet this definition. So some of the more common examples are number one, people who are found eligible for Canada Pension Plan disability benefits are automatically eligible, medically eligible for ODSP. The reason being the definition under the Canada Pension Plan is a lot harder to meet. It's a higher threshold. So if you can meet that definition, then the law says you can meet the definition under ODSP. So if you have clients who you happen to know are on CPP disability, you might want to refer them for some advice because they may not have to qualify for ODSP, the medical eligibility part. Another common example is people who are over the age of 65 and do not qualify for old age security. So usually these are people who have been in the country not a very long time. They are over the age 65. To qualify for old age security, you have to be residing in Canada for at least 10 years to even get a partial pension. So these are people who have been living in Canada less than 10 years, but they are over the age of 65. They still don't qualify for old age security, but there's a special class, what we call a prescribed class under the ODSP legislation. So anyways, getting back to the main thing, because this is most of the people who are found medically eligible for ODSP, they have to meet this definition. So there's a few key elements to the definition. So first of all, you have to have a medical condition or medical conditions with impairing. They say that in the legislation impairments, which I really hate that word because a lot of times people don't understand what that means. I like to read this as impairing symptoms. I think is an easier way to understand this. Doctors often don't, or at least from my experience, don't understand what do they mean by impairments, but they do understand impairing symptoms. Okay, so that's what we're looking for. So a medical condition could be more than one with impairing symptoms. They can be physical, they can be mental health related, they can be both. Okay. And they can't be just something that's a one-shot deal. These are symptoms which are either continuous or they're reoccurring. Okay. And they have to be substantial. Okay. And the symptoms have to cause restrictions, a restriction or restrictions in daily activities to the point where a person can't work, like have gainful employment, or they can't take care of themselves or take part in the community. Most of the cases, from my experience of people who meet this definition, really it's they can take care of themselves. They might even be able to take part in the community, like they can do their banking maybe, they can go to doctor's appointments, whatever, but really they just can't manage to be gainfully employed. Okay. And these symptoms and these restrictions have to last at least a year or more. Okay. And that is from the time period you fill out the forms. So if a person has had symptoms for the last 10 years, that's not good enough if it's not expected to last. It's like looking forward. Okay. And this is where you come in. They have to be verified by a qualified professional. All those elements have to be verified by a qualified professional, medical professional. And medical professionals, usually it's doctors, medical doctors, but there's also nurse practitioners, and there's a few other classes of people. But mostly what we find is medical doctors, sometimes mostly family doctors, sometimes specialists are the ones that are filling out these forms. Okay. And as you'll see in a few minutes, the forms are structured in a certain way that when you fill them out correctly, they match up to this definition. So you don't have to memorize this definition. You don't even necessarily have to be familiar with it to fill out the forms and to meet all the qualifications. Okay. So why don't we move to the next slide, Laura, which is the disability determination package. As you may well know,
Did
the
that
way
work, Christine?
it did
Sorry.
work
Okay,
very
great.
well.
Thank you.
The disability determination package, or DDP as we call it for short, is the package that is used to for the medical eligibility part of the ODSP program. So it has a few different parts to it. The part that you are probably quite familiar with and is probably the most important part of the package is the health status report. Okay. So just so you know, the DDP can only be you can only get it through an Ontario Works office or an ODSP office. Some people think that they can get it online or maybe copy someone else's. It doesn't work like that. Okay. So basically, your forms, you have to you have to go through a certain process before you get a package, and it will have your identifying information on the forms. Okay. For the patient, that is. Um, so as it says here in the slide, a patient comes to you with the package. There's no requirement for you to consult with the patient before or during the completion of the package. And often doctors do fill them out without their patients' involvement. And sometimes patients don't even know what's written a lot of times don't know what's written in the packages until we get a copy of it later on. And while you don't have to consult with the patient, we do encourage doctors to do that if you can, for different reasons. Okay. Um, and one of the main ones being, hopefully, there's a more accurate reflection when you fill out the forms with the client. We call it the client, your patient. Um, if you consult with them beforehand or especially during. Okay. So next page, Laura. So the package includes, like I said, what I think is the most important part, the health status report, and it's probably the one you're most familiar with. The health status report contains two parts to it, two scales. One of them is the intellectual and emotional wellness scale, and the other one is the activities of daily living index. Okay. One thing you may or may not know is that the health status report does not, so there's two main parts to it, which is the health status report and the activities of daily living index. They're kind of separate parts of the same uh, package or whatever. And they do not necessarily have to be filled out by the same medical professional. So the health status report can be filled out by one medical professional, and then the activities of daily living index can be filled out by another one if you feel that there's another professional that might know more about the person's activities of daily living. So a good example, so most of the times we get the same doctor filling out both parts, okay? Usually it's family doctors. Usually they're somewhat aware of the person's functioning. But there are cases where, let's say, a family doctor might fill out the health status report and then have the person's physiotherapist or chiropractor fill out the second part because they feel they might be more um, knowledgeable about that part. Okay. And that is allowed. So the health status report, the first part, which is the listing of the conditions and the impairments and restrictions, that is there's only kind of like a small list of people who can fill out that part. But the activities of daily living index adds on a few other professionals. So again, the examples are physiotherapist and chiropractor. So these have been recently added on to allow them to fill out that part. Okay. So other than that health status report, including the activities of daily living index, Other main parts of the package is a self-report form. So the patient can fill out this form. It's optional. There's good things and bad things to filling that out. So it is often helpful for them to fill it out because it gives us a better idea of what's going on with them. Sometimes you have to be careful. They have to be careful because if they get into too much detail and this ends up in a hearing, sometimes that self-report is part of the hearing, and sometimes they'll say stuff in the self-report that can be used against them at the hearing. So a person might say, oh, I can stand for 20 minutes, and then all of a sudden at the hearing they can only stand for 5 minutes, and then there's a discrepancy. So they can fill it out and it can be helpful, but just be very careful that whatever they put in there is absolutely accurate, and so that it doesn't come back at them later on. Okay. um and what else is, oh, the other important part of the self-report, I noticed some doctors, what they will do is they will have the patient fill out the self-report first, and then it informs the doctor to fill out the health status report. What the person puts in the self-report sometimes finds its way into the health status report. Um, the other parts of the DDP is a consent to release medical information. There is the ability for the Disability Adjudication Unit, which is the special part of the ODSP system, the special department, I should say, of the ODSP department. Um, they can contact you for more information or even for documents. In my experience, they don't do that very rarely. They might sometimes send you a letter asking you for more documents. So this is usually a case where it looks like maybe there's something to the person's case, and there's not enough medical documentation. And so they ask if there's, imaging, or is there consultation reports with specialists. So if you get that, it's really, really helpful if you can send in medical documentation in response to that letter. It's also helpful, of course, when you're doing the health status report and you're going to send it in, to include medical documentation that you think might be helpful. Now, there are some doctors who will copy their whole chart and send it in, and that is not helpful. And again, we understand you're busy, so you might not have time to kind of go through and pick out what might be helpful for a package. But you sending in copies of the person's normal mammograms, person's normal blood tests, all that stuff, it really is kind of a waste of everybody's time. So if possible, it would be great if you can send in supporting documentation, but documentation that's relevant to what you have written in the health status report. Okay. And the other parts of the DDP are just instruction sheets. Okay, so the next page, Laura. So again, the health status report and the activities of daily living index have to be filled out by the appropriate medical professionals. Like I said, they can be filled out by 2 different professionals as long as they qualify. Um, and if you send it in and there's certain parts of it that are really important and they're missing, the Disability Adjudication Unit is supposed to send it back to you and ask you to fill out sections, okay? And that does cause a delay. And one of the things about you delaying, if you don't send in the package correctly in the first place, is when a person succeeds at ODSP, they're going to get retroactive benefits. And those retroactive benefits are only going to go back to the time when their package is submitted and complete. Their package is not complete until you have filled out the important parts of the health status report. Okay. So it'll show in another slide, one of the really important elements of the health status report that doctors quite often miss filling out, or just checking off a box, is the duration part of it. You have to confirm that the impairing symptoms, you have to you don't have to confirm. You have to fill out the part of duration, and you can indicate more than 1 year or less than 1 year. If you just leave it blank, the package is probably going to be sent back to you. Or even worse, sometimes the package will go through and then it has to be dealt with at a later stage. Um, so again, try to stress that please try as best you can to fill it out accurately and thoroughly. Okay, next page, Laura. Okay. Okay, so you'll see, can we go to the next page, Laura? We have some sample pages
This,
from the
yeah.
forms.
Is this right?
Yes,
Okay.
absolutely. So this is the first page. You're quite familiar with it. Normally it's pre-printed with the person's identifying information. Okay, and then the next page, Laura. So this is probably one of the most important parts of the package. Okay, it's part of the health status report, it's part page 3. This is where you are going to list the medical conditions, the impairments, or as I call them, the impairing symptoms, and the restrictions. Okay. And next to it, as you will notice, there's also questions related to duration. So you'll see, and that's a again, key part that often doctors miss. Check off either 1 year or more or less than 1 year. Check off reoccurring or continuous, and check off the prognosis. Okay. But the most important part out of those boxes is the duration. If you don't check off the prognosis or you don't check off whether it's continuous or reoccurrent, it doesn't kill the application. But if you don't indicate the duration for the conditions, they can't be included as part of the case because they don't meet the minimum requirement. Okay. So, um, okay. So next page, Laura. Okay. So as I've alluded to, applications often fail not necessarily because people aren't disabled, but because the forms aren't filled out correctly. Um, so even if you are trying to put little notes in our other parts of the application, or even sometimes doctors will send a separate letter to explain in more detail the person's situation, which is they have good intentions, and we're grateful for that, and the patient is grateful for that. But if it doesn't contain the elements that need to be met, then that condition may still not be included in the case. Okay. Um, and the other thing that you should know is that the people who are reviewing the package, which are called medical adjudicators at the disability adjudication unit, they are not necessarily medical professionals themselves. Okay. They're just bureaucrats who have been appointed to do this job. They have some medical knowledge, medical training, but they aren't necessarily medical professionals. So try to be clear and not use abbreviations. I mean, there's a lot of abbreviations which we're all quite familiar with, but just to be on the safe side, um, don't use abbreviations. And please, if you're handwriting, um, you're filling out these forms in handwriting, please make sure your handwriting is clear. We know doctors are generally notorious for having bad handwriting, but please, it's so important that you fill this out in a way that the average person can read it. So here we see, next page, Laura, please. You'll see here some examples. Hopefully you can see that. An example of a page 3, which is completed poorly, and one that's completed well with details. So you'll see on this one, so here it just shows one condition. And one thing I should mention also is the more conditions you list on here, generally the better. Okay. Um, you can and we can argue, or they can assess the person cumulatively. So they can look at the effect of multiple conditions on a person. So there might be a condition which in itself is not disabling, but together, so a person might have depression and then they might have back pain, and all together it makes the person disabled. So please try to add on any conditions you feel are significant, okay? So here, you have different conditions, and here we have fibromyalgia, and the doctor just put, or whoever filled it out, just put pain, and um, they did put in a restriction, which is cannot lift heavy objects, but there's not a lot of detail in that condition. And there isn't, very important, you can see the duration part has not been filled out. Okay. So you'll see next to it a better example, which shows in more detail, because fibromyalgia is normally not just pain. There's fatigue, and often there's depression, and there's, so anything that you think, the more details that give a better idea of what is going on with this patient, the better. Okay. And again, so like I said, the duration. So the second condition, depression. Okay. So the person who had completed this, again, just put down depression and then put down low mood in the restrictions part. We see this quite often where the doctor, for some reason, doesn't seem to understand that they have to fill out restrictions in daily living. And so the person just repeats the impairing symptoms. And that is not helpful to to the patients, to our clients. Okay. We need to know from depression, what are the impairing symptoms? Because depression, often it means low mood, but some decision makers don't necessarily assume that. So usually with depression, you have low mood, you have probably cognitive deficits. You may have problems with sleep. So those are some examples of impairing symptoms you might want to consider adding in there. So here you see a better example where it's more thorough. And for restrictions, you can see it's not the repetition of low mood, but, what are some daily activities which are negatively impacted because of the depression and those symptoms. So you can see here some examples, right? Difficulty working with other people, difficulty maybe making decisions, et cetera, finishing tasks, that type of thing. Here, the third condition, asthma, is an example of, so SOB, which most of us understand that to mean shortness of breath. But again, they may not assume that. So the medical adjudicator may not know what that is, or may be wanting to be difficult and saying, we don't know what SOB means. Okay, so shortness of breath is an impairing symptom, but if you put it in abbreviated form, it may not be understood. And again, more details is helpful. So that gives an idea, some restrictions. So those, so that's it. So next slide, please, Laura. This section has kind of categorizations of certain types of conditions. So it gives a better idea of whether the person is experiencing mental health conditions, substance related. A lot of, some doctors don't add in substance abuse conditions, even though them in themselves can be quite disabling. And I'm wondering, years ago, the legislation made it very difficult for people to get on ODSP solely because of substance abuse. So I'm wondering if maybe some doctors don't add that in or don't consider it because of that. I'm not sure why, but anyway, so that's, so that it's important to add in mental health conditions, substance related. And another myth we still hear from our clients, that doctors don't want to help them with the forms because the person has a mental health condition and you can only get disability if you're in a wheelchair. That is just so completely false. So even a person with only a mental health condition, only with substance abuse, they can be found eligible for ODSP. And a person can have only a physical condition, does not have to be in a wheelchair to be found eligible, medically eligible. Another thing that sometimes gets forgotten is some people have been assessed to have a learning disability, and that's relevant as well. It's harder to document that, but usually, but you could add that in there. So it's another thing to add in. Now, the section about the neurodevelopmental disorders, I think one of the reasons they ask about that is because there is a special class of people, again, like I said, some, the special classes, prescribed classes of people who can get on ODSP without having going through this whole process. So I believe we see it very rarely, but people with developmental disorders, I think, can fall into the prescribed class if they meet certain requirements. So anyways, okay, next page, Laura. So this is the intellectual and emotional wellness scale. It's a really important part of this package if the person has intellectual and emotional impairing symptoms. Okay, so we are talking about mental health symptoms. We are talking about cognitive symptoms. So if a person has like a mental health condition, a substance abuse condition, a developmental delay, a learning disability, you definitely want to fill this out. If a person even has just a physical disability, but it might impact on their mental, on their intellectual and emotional wellness. So a person who has, let's say, a chronic pain condition, well, hopefully, if you think it also impacts on their mental health, you might want to add that as a condition, the mental health condition. But if you don't feel it's actually a condition, but it might impact on their intellectual and emotional wellness, you can fill out this section. You don't have to fill it out if it doesn't apply. Okay. So next page, Laura. So you see, this is what it looks like. You're probably quite familiar with this. And so there are, some very, specific mental health, intellectual and emotional kind of components, and they ask you to rate it. And the first column is if you just don't know and you can't rate it. And then the others go from 1 to 4. Sorry, 1 to 3. It used to be 4. 1 to 3, and it's like the different levels. 3 being that the person has severe symptoms, 2 being moderate, 1 being mild, 0 being no symptoms in that particular component. When we are doing cases, usually the decision makers are looking at profiles which have more 3s and 4s. If a person has a lot of 1s and 2s, they have less chance of success. Although there could be like, you could have 1s and 2s for a lot of things. Sorry, 1s for a lot of things, and then they have 3 for, let's say, anxiety or, something very specific. So it's not just because the person has a lot of 1s, it doesn't mean that or 0s, it doesn't mean that they won't succeed. But it has to kind of match up to what their situation is. But generally speaking, the more 2s and 3s that are in there, the better. But of course, some of these components are not that common. So there's, asking about, let's say, delusions, grandiosity. So that's not necessarily in a lot of cases. So what we see quite often is anxiety, depressed mood, concentration deficits, sleep problems. Those are the types of things that are really, especially, people with mental health conditions, related conditions, those are the ones that they really look at. Okay, next slide. Laura, thank you. Okay, so here, they just want a little more information about things. So they want to know how long you've known them. So again, if you've known them longer, usually that's better if you're supportive. Although obviously if you've known them for only a short period of time, it's not fatal to the case. But it's usually better if you've known, usually carries more weight if you've known them for a longer period of time. And then it asks some background, details on the patient. It asks about treatment, so whether or not, the person has engaged in any kind of treatment. And if you have consultations from other specialists that you think are helpful, we would hope that you would include them, but at least mention them in this part here. Okay, next page, Laura, thanks. Okay, so as you probably know, there is a part for visual and auditory impairments and conditions. So you just fill that out. Try to fill it in, and we don't see this too often, but if a patient does have these, try to fill this out as specifically as possible, because the degree to which they have the impairment and the frequency, that's all relevant. Okay, next page. Okay. So again, the first half relates to the previous page, and then the second part is important. So it asks about treatment again, including hospital admissions. But the really important part is about medications. Okay. It's really important if you can try to fill this out as detailed as possible. Reason being, by the time a person ends up at a hearing, a lot of our clients, and you probably know that with your patients, don't know the names of the medications that they have tried or even are on. Sometimes they mix medications, put it all into one bottle. So we do try to get a medication list if we're at the appeals process, but that doesn't always happen. We're not able to get it. So we do have clients, like I said, who end up in a hearing and they can't tell the adjudicator what they've tried. They can't tell what they're on even now. And also, it's helpful if you can indicate here like dosages and even changes in dosages, if you can manage to do that. Okay, so next page. So again, these are other kinds of interventions or treatments. If you can fill that out as specifically as possible, that's would be helpful. Response to treatment is also helpful, so that, for instance, a person has engaged in physiotherapy for what period, and then if you put down it didn't help or something like that, that's helpful. Also, if there are reasons why the person didn't engage in certain kind of obvious treatments. So physiotherapy is a common one. A lot of our clients don't go to physiotherapy because they can't afford it. Even a lot of doctors don't seem to know that OHIP covers physiotherapy for people who are on social assistance. It's limited, very limited, but it is available. And our clients don't know that, or even if they are referred to physiotherapy, they go through with it, it's very limited, and then they can't afford more. So if you can put that in there, that would be helpful. And yeah, so that's it for that page. Can we move on to the next page, please? Okay, so this is the signature part for the health status report part of it. So there are two signature pages as part of the package. So it's at the end of the actual health status report part of it. And then there's another signature page that's part of the next part, which is the activities of daily living index. If you are filling out both sections, you can just fill out the last part, the last signature page. It doesn't hurt for you to fill out both pages so that it's clear. But if you just fill out the last one, it's fine. But obviously, if there's two different medical professionals filling these out, then you should fill out this part, and then the other person would fill out the last signature page. So hopefully you'll see what I mean when we move on to the next slides. So Laura, next slide, please. And this is, as it says, an extremely critical part of the application. Other than the health status report part where you list conditions, impairments, restrictions, duration, this is a very important part of the package. Decision makers often look at this. People are often refused because of the way this is filled out if it's not supportive. Okay. So next page, Laura. So as you've probably seen before, this is the way activities of daily living are assessed. Okay, so it's similar to the intellectual and emotional wellness scale. There's different components of daily living, and you rate them. Now, if you see something in here that you don't sorry, if you think there's something missing in here and you think it should be stressed, you can just add it in somewhere, either here or on another page. One of the common ones is I don't see a section here that's specifically for lifting, okay? And I think some people will put it under physical activity, but I don't think it actually says lifting. So if you feel lifting, which is a very important restriction in daily activity, if you have back pain or shoulder pain or whatever, if you think you want to make it clear, just put it on another page. But otherwise, basically, these are the components that they ask you for. And again, it's the same thing. DK is don't know, 0 is no restriction, 1 is mild, up to severe. Okay, and again, like the other scale, successful cases have more higher ratings, generally 2 to 3s. And again, there may be cases where a person might not have a lot of 2s and 3s, but it's still successful. So for instance, a person might have mental health conditions, 2s and 3s for, you know, uh, taking public transportation, for taking medications, that type of thing. But they're going to get maybe a 0 for bladder control or, bowel control because they don't have that problem. So, again, it has to be tailored to the particular situation. And one thing that I think a lot of doctors do, which is to the detriment of our clients, is that they will only look at kind of the physical ability to do things. So, for instance, a very good example is one of these components is ability to take public transportation. So, a doctor will look at that and say, a person with a mental health condition, that person could take public transportation. They can get on a bus, they can stand on the bus without thinking about the whole, looking at it more broadly, that a person, let's say, with social anxiety cannot take public transportation. So you got to tailor it to the particular situation, okay? And look at it more broadly. And if there's details you can put in here to give a clear idea of what's going on, that's better. So for instance, if the person can go grocery shopping, but they can never go alone, that should be noted there. It's really important. Um, and it's helpful if you can indicate either here or somewhere else that the rating is, let's say, severely restricted grocery shopping if they would have to go alone, but might be mildly restricted if they go with another person. If you can be more specific with that, that could be helpful. Okay. Next page, please. Yeah, so this is, asking about assistive devices. If you happen to know the person has to use a cane, you should put it in here. If you happen to know if they have to rely on community support, you should put it in here. For assistive devices, it's even helpful if you indicate that it's been prescribed. So usually the decision makers will kind of make a distinction between people who have been prescribed assistive devices, let's say a cane by their doctor or physiotherapist, as opposed to somebody who just decided to go to Shoppers Drug Mart and buy one for themselves. Okay. So, and this is, again, the signature line signature section that I was talking about earlier. This absolutely has to be signed by the person who's filled out like this has to be filled out. It's mandatory, this signature section, whereas the end of the health status report doesn't have to be signed, doesn't have to be filled out if you were the same person who filled out both sections, if you know what I mean. So, but it's always helpful if you do both sections just to be thorough. Okay, so those are the forms. Okay, next section. Thanks, Laura. Okay, so we already talked about the self-report. It's an optional form, but it can be helpful. It can be helpful. Goodbye, Dr. Cameron. It can be helpful to explain in more detail what's going on with the person. It's, if a if a patient is asking about these forms, we don't expect that you're going to go through it with them. But if you are in, let's say, in an office where there's social workers, or you're aware of an agency that might be willing to help them for the people who need it, because some people can fill it out themselves, then it would be helpful if you can kind of get them connected. Okay, so next page. Um, so the application package, you can either send it in yourself. And like I said, there are doctors who will fill out the forms without any involvement from the patient. And that's fine if that's the way they want to do it. We, of course, prefer and hope that you consult with your patient if you have time before or during you filling out the forms. And at least if you can maybe have them take a look at it before you send it in, that can be very helpful as well. For a couple of reasons. So first of all, there are clients of ours, we realize that they have never told the particular doctor about a condition. So they may have other conditions, and then we realize the doctor never knew that the person was feeling depressed or whatever. Okay. So it's good that they can now talk about it and have it included in the package. And even if it's not included in the package, at least it opens up, a line of communication. Um, and the other thing is, it's not unusual that when the person looks later on at the activity, the way the activities of daily living index was filled out, it just doesn't make sense according to their experience. And it's possible that the doctors don't know how disabled the person is. They might not know, you may not know that the person can't, go grocery shopping without help or whatever. Okay. So this is a good time before it gets sent in for you to have that conversation so that these ratings can be adjusted as applicable. Okay. And maybe again, maybe it's then that you realize how disabled this person really is. Okay. So next page, please. So these are the important tips. I think as I've tried to stress, try to be as detailed as possible with supportive details. Uh, don't shy away. If you think a person may have a condition, it might be disabling, you might just want to put it on there. So it's not unusual for a doctor to put query, migraines or something that you're not fully sure about what the actual name of the condition is, but the person has symptoms, impairing symptoms, they're restricting daily activities. They're probably going to last for at least another year. Add it in there. You can put query if you're not, you know, fully secure in what the diagnosis is. Okay. And you can always, like I said, put in the application that they're seeing a neurologist or a psychologist, or they're waiting to see them. Okay. Try to be impartial. Like you want to, of course, we hope that you want to help your client, but it doesn't really help your client if you are exaggerating on the forms. We have doctors that we know who we're pretty sure are exaggerating, and I think they're done with good intentions, but it all comes out during the process. So if you're saying that your patient has severe symptoms, severe restrictions in daily activities, but you've never considered doing, sending them for imaging or sending them for specialists, well, that just doesn't match up. That's going to definitely be questioned. So, try to be fair. We want you to support your patients, but try also to be objective. And also consider, honestly, I've done many, many hearings over many, many years. I have never asked a medical professional to testify at a hearing. I think there are other lawyers who do sometimes, but if you feel that you could really make a difference in the person's case, you can volunteer to testify if it goes to a hearing. And I think most lawyers would appreciate that. or you might be asked, and it would be great if you could. You're not expected to sit through the whole hearing. Normally, they would have you go first so that we can release you. You can be released from the obligation. So I'll just put it out there, even though I don't think it happens very often. I have used other types of, they're not medical professionals, but sometimes agencies. So for instance, a person might have a worker that they've been with for, some time from let's say a domestic violence shelter, or maybe a counselor or social worker. So I've used those kind of people in hearings to testify. Okay, so next page, please. And I think I've alluded to some of the reasons that ODSP applications are denied: missing verification information, such as duration of 1 year. And I know it's easy to miss because it's just a checkbox, but it is so crucial to check that off along with filling out the details for the conditions. Even if you put query, you don't know exactly what the diagnosis is, but the symptoms, be thorough in listing the symptoms and the details, the restrictions, and also try to be consistent. If you put down on the first part, page 3, that the person has, severe limitations in, you know, walking, prolonged walking, something like that, make sure that matches up to what you put down on the activities of daily living index. Lack of treatment is an interesting one. Okay, so decision makers will look to determine whether or not a symptom and or a restriction is substantial. They will look behind that. So you filling out the forms as a doctor doesn't mean, just because you think the person is disabled, doesn't mean that that will be the decision. So the disability adjudication unit takes it into consideration. It's a really important part of the decision-making process, but it's not automatic. So one of the things, so they have to determine whether the symptoms, the impairing symptoms and restrictions are substantial. Some of the things they look at is, has a person been sent out for tests? Has a person been sent out for specialists? What kinds of treatments have they been involved with? Physiotherapy, pain injections, those types of things. Okay. So a lack of treatment is looked at as suspicious for a person not being disabled, although it's not totally indicative. So we have, especially with people with substance abuse issues, for instance, who can't manage to keep it together, to get to treatment, to get to a specialist, whatever. They still can be found disabled with the right documentation, okay, with the right support. But of course, it has to be explained why there's a lack of treatment. If a person doesn't even have medications, again, if there's an explanation, side effects or whatever, then it's good if you can explain that, because again, that will be looked upon with suspicion. Okay, next page. Okay, so that's basically the main part of this presentation. And if you, as a medical professional, are filling this out and have any questions about it, you really want to help your client, and you're confused about something or whatever, please feel free to reach out to your local legal aid clinic. If you got an invitation from us, you are probably in our catchment area, so you definitely can call our office. Even if you are not sure, you can call our office and we will either talk to you or refer you to your local legal aid clinic. So just so you know, Ontario has legal aid clinics funded by the provincial government all over Ontario. Each of them has a specific catchment area we have general service clinics, which all of them do ODSP cases. And there are also some specialty clinics. So, please call for advice if you really need that. Because, if you can get something clarified at this point, it might make a big difference to your patient and our clients, okay? Because if a person is refused, initially they have to go through a whole process, which can take a year or more to finalize, okay? And, and if things aren't done properly along that process, then they could not succeed at the end. And we do help people with ODSP cases. And what we normally do, we normally aren't involved in the initial stage. We normally don't review applications before they go in. We just don't have the manpower for that, although, we keep trying to talk about ways to change that. So we often don't see people's cases until after they've been refused. And then we do try at that point in time. It's our job to try to strengthen the case. So that's why we often will write to you for a copy of a chart or to ask you for clarification. But of course, if it's done right the first time, it is better for everyone involved. So hopefully, that can be done, and hopefully this presentation does help with that. So I don't know what time it is, but I think we have a few minutes. So Dr. Dumo, you're the only one left here. I think this is being recorded, so there might be other doctors or medical professionals who will have questions later on. But do you have any questions or any comments or whatever before we end this presentation?
No, I think, yeah, the presentation has been really helpful. I think it's clarified a few things, questions I had. I don't have any questions. I think I now know how detailed information we need to put in, especially those initials, the diagnosis and impairments. I think that's really helpful. So thank you very much.
Good. And thank you so much for attending this. And so hopefully that will help with your patients. But again, if at any point you have any questions or anything, feel free to give us a call.
Great. I'm going to stop the recording.